Ms. Birdsong Terry, what will new bus rapid transit service on West 25th Street do for the neighborhoods along the route, and how is RTA supporting economic developments in other neighborhoods around Cleveland, like Slavic Village? My wife and I live about a mile from Slavic Village, so talk about that if you would.
Sure, I would be happy to. Thank you, Chairman Brown. It's amazing the amount of infrastructure that can happen and then the effects that it can provide on a positive note for the residents of Greater Cleveland. We currently have a BRT in place that's been around for about approximately 15 years, so BRT is not new to Cleveland, as you know. However, being able to duplicate that through new projects and with the help of the IIJA is just something that we're really excited about, to be quite honest. There are two particular projects that I want to highlight in response to your question, Chairman. The West 25th Corridor priority project that we have, it's a BRT project in collaboration on the campus of Metro Health. Metro Health is a medical facility that really serves as a level 1 trauma center as well for those type of incidents that we discussed earlier. And it also kind of goes right through the middle of a Latino community along West 25th that really provides an opportunity for accessibility when RTA has service there. Making sure that we can provide opportunity for economics, work, health for those residents of that area is tremendous. We also have opportunity, as you mentioned, through Slavic Village, to be able to serve that corridor. And these are lower income areas that are on the cusp of kind of gentrification in a positive way. Being able to do that really serves the ability to become an economic driver in Cleveland. We're looking at design work for the Metro Health, and with the Slavic Village area, that particular award, we had a $432,000 grant from the same TOD pilot grant program as before. And the goals are very similar between the two projects. We expect to be able to put those into effect within the next coming years. Again, this is just a really great opportunity to show that we have a economic prowess in public transportation, and we're not just simply moving people, we're actually connecting them to opportunities that allow them to be able to contribute to the economic vitality of the region.
Thank you. I would only amend your comments that Metro Health is a public hospital.
Yes.
Equal in quality to more renowned hospitals at University Hospital and Cleveland Clinic. So thank you for mentioning them. I'm happy our committee could authorize funding for rail car replacement. Well, let me back up a second and to ask you about that before the committee. Tell the committee more about the current state of the RTA's rail car fleet. You said they are 38 to 42 years old, something like that, 4 decades old. Talk for a moment about what that means and what replacement will do.
Thank you, Chairman. I'd be happy to. You're correct. Our rail cars, and we have approximately 76 of them, date back approximately 40 years. They vary in range between 38 and 41 years of age. As I mentioned previously, that is well beyond their useful life. And as you well know, we are in the throes of being able to make sure that we can solidify funding to replace all of our rail cars for heavy and light rail. We're actually looking at what I would call a flex car to be able to take advantage of training so that we can actually train up our mechanical staff to make sure that they're at the cutting edge of technology. We're in the beginning stages of negotiation, or I'm sorry, in the middle stages of negotiation for a car builder, and with any luck, we'll be able to announce that publicly this spring. We currently are looking at a $393 million price tag to replace all of those rail cars. So we know that transportation is not cheap by any means. However, it does serve for multiple generations, and that's what we're looking forward to. Just to give you a quick example of the inflation that we have to deal with, just last year, we were looking at a price tag of $300 million. And so that's definitely increased over time. So the longer we wait, the more expensive it will be. And then also with a lot of the rail incidents that have happened within recent times, that is a byproduct of waiting too long. And so we want to make sure that in Greater Cleveland, we're able to take advantage of being proactive. And we have a task team that we have put together for quite some time. And we actually put $10 million aside out of our own budget annually to make sure that we can bridge that gap. We have currently identified $213 million toward that. And our residents are really excited to be able to feel safer on our system. We do everything that we can to make sure that we are providing that type of service. But to be quite honest with you, we hold in more trains than we would like. because we have to make sure that they're safe before we put them out. So our ideal situation is a 60-car fleet to be able to be in service and serving our residents within the next 3 years.
Thank you. And I would point out, and thank you for what you're doing on investment. I would point out this committee, before I was chair, was just referred to as the Senate Banking Committee because it was way too much about Wall Street. Now its focus in this committee is housing, and this focus in this committee is public transit. And that's why the investment, and I'm hopeful we do even more. So thank you. Mr. McMillan, let me shift to you. And I know I'm over a bit, and Ranking Member Scott can do the same thing.
Please take your time, sir.
Okay. Thank you, Senator Scott. Thanks for alerting the committee about transit agencies, some of their failure to establish their safety committees. We need these committees to function effectively. What more can FTA do to ensure safety committees are functioning? And as you answer the question, tell us what worked well at the MTA in Baltimore as the safety committee was founded, and especially your experience as a driver for more or less close to 2 decades. What new designs for operator compartments make them safer for pedestrians and riders and operators? So bring your personal experience into this answer, if you would.
Okay, yeah. So first of all, it was the ATU who first brought it to the FTA's attention that a lot of agencies that were covered by the unions were not in compliance with the new the IIJA provision. Once they were alerted about it, then it was told by the FTA to our ATU International President, John Costas, that they continue to have the ATU to give them the updates of who's out of compliance. If the FTA could take on that responsibility to be able to ensure that there's a reporting agency within the transportation industries to report back to the FTA about where they are with the IIJA or the Joint Safety Committees, that would be a great help on their part. Also, too, in Baltimore, and once again, I have to give accolades to Senator Chris Van Hollen, because what he did, not only as authorizing the bill, being the author of the bill, he continued to have steady communications with the labor leaders in Maryland to ask them, how's it going? Where are you at? And just kept an input on it. Our ATU national president has also had the leadership of from the unions to report back to him so that he could report to the FTA as to where we are. So when I was able to go back to the table, and I'm also a member committee of our Joint Safety Committee, so as soon as I tell the administrator of MTA that, oh, I just had an update with Senator Chris Van Hollen to give him this, they want to make sure that they were in compliance because they did not want to have a bad report. Also, too, when you were constantly, what we reminded them of what could be enforced, there's a provision in the IIJA to say that funding should be withheld. Those penalties need to be enforced for those who aren't in compliance. And I think if the FTA would enforce these regulations, it would help better with forming and getting these committees started. From the operator standpoint, being a frontline employee, it's great to hear from the frontline employees. They know what's out there every day. It's not just done by paperwork or analysis that come in through data from just somebody who rides the bus just one day. The commonly occurring assaults, also the bus designs. Our ATU has also created what they call a study on a future bus. This has to do with the A-frames on the bus where there's bad vision sight, also with the mirrors that are put on buses to sort of, it will give better pedestrian protection for those who are crossing the street who may be caught in the blind spots. Also, when the pandemic came along, you had the filtration system. If a person was to cough and the particles get in the air, it would get into the ventilation system. That ventilation system came straight up to the bus operator's compartment. There has been filtration systems that's been recommended on the ATU's behalf to use. Also, closed off compartment when it comes to protecting the operator from not only diseases, but also from assaults. A completely closed off compartment as if you were in a cockpit of an airplane. We also have situations that protect pedestrians. Some of the suggestions that we have given to the administration was if a person can see themselves getting on a bus and they see their face through a camera, it's more likely that they'll think twice before they commit an assault on the operator or harm their fellow passenger on a bus because they know that they can be identified.
Thank you, Mr. McMillan.